We know that without allies in our legislature, we can't achieve any of the goals that we have as a coalition and as a movement. So we'd be remiss if we didn't have public officials to speak to you today. First, I'm going to welcome to the stage the senator from the 11th District, Senator Hasegawa.
One of our healthcare champions.
Thank you, beautiful healthcare activists. I think I'd reverse what he said, though. We can't get anything done in the legislature without you being out here. So thank you for being here. You know, we've been trying, I've been on this issue since when I ran the union, Teamsters Union, way back in the 90s, and going into late 80s and then early 90s, costs of healthcare was eating up all of the wage increases we were trying to negotiate because it was escalating so fast. And who would have thought that 3 decades later now, we're still facing that same problem. And it seems to be getting worse and worse. The greed in the system is just unconscionable. It's inhuman, actually. So we are trying our best. We need to build our numbers in the legislature, though, that are willing to actually step out and take action to support universal health care. So, we had a really simple bill this year because all the years that I had been in the legislature previously, through 2005 up until now, we've always heard, well, we can't do it in our state, let alone the country, but our state, because we needed waivers, right, from the federal ERISA and others. So we've had a really simple bill. It was just a joint memorial, 8006, to ask Congress, give Congress actually a choice of doing 3 things. Number 1, just create a universal health care plan for everybody in the country. But in the likely event you're not going to be able to do that, number 2, pass a bill in Congress, sponsored by Congressman Ro Khanna, actually, that gives states the right to establish our own. But in the likely event you're not going to be able to do that either, then the last option is just give us the waivers so we in Washington State can take care of our own. Unfortunately, this is the 2nd year in a row that bill has died in the House. We've got it out of the Senate over to the House, and for some reason the House just doesn't want to move it. So that's just the latest report to you on the status of it. I think that they don't respect the power of the people and what the people really want and need, and as is said in the Universal Declaration of Human Rights and in the previous speaker, healthcare is a human right. And why aren't we providing for this human right? Why are we making a profit center out of healthcare? It's just unconscionable.
That's right.
I have a bill for that too, actually. So, at any rate, thank you for being here. We've got a lot more power to build so that they can start hearing our voices out here. And I want to thank you for being the core of that power building, and all power to the people.
Thank you.
Thank you, Senator. Let's hear it one more time for Senator Hasegawa.